How y'all doing? Welcome back after what? 2 months? 3 months? I missed y'all. So I hereby call the meeting to order. The Community Relation Committee of Board of Directors of NYC Health and Hospital for Tuesday, June 3rd, 2025. I now call a motion to adopt the minutes of the March 4th, 2025 meeting. Dr. Pecan,
Yes.
Dr. Katz,
Yes.
Ms. Hernandez Pinero. All in favor? Opposed? The minutes has been adopted. So I would like to remind all of the upcoming Board of Directors annual public meeting for the fiscal year 2025. I encourage our CAB members to attend and provide testimony. This meeting will begin at 6 p.m. on the following dates, and so everyone should attend. And I just a quick note. Someone said to me, "Oh, you're going to Staten Island for the meeting?" I said, "Oh, absolutely, because they feel like the lonely hearts out there. So we must go out there and support them." So I look forward to seeing all of you out there. Now, I turn the meeting over to our very own Dr. Katz for his remarks.
Well, thank you, Madam Chair. And my remarks are printed, and I'm not going to take up our time with reading them. I want to mention some things that I think are, particularly good. I was very pleased that Elmhurst and Queens got together and said, let's have a place for our business services so that we can use space for our patient care, which is the most important thing, and move some administrative space to Queens Boulevard. We celebrated $2 million in investments to our nurses because we believe that training nurses up is a great way of guaranteeing best care. Many of you know from her many years at Met, Dr. Anitha Srinivasan, who was a breast surgeon. She's going to become the CMO of Metropolitan. Our longtime CMO has retiring after I think he has more than 30 years of action, making sure that people know that we welcome immigrants, that our services are available for immigrants, and that we want them to get the care that they need at health and hospitals. Several of us were at Kohler with Mr. Hank Carter, where Wheelchair Charities gave some really breathtaking equipment to help with rehab, things like a walker platform for bariatric patients, a soundboard for people who couldn't speak. It was a great event. I told Mr. Carter I was so proud of him, I wanted to name a hospital after him. Then I realized we had, so there was nothing I could do beyond that. All 5 of our post-acute facilities were recognized as LGBTQ long-term care equality leaders. We participated with the Department of Veterans Services to honor our veterans. At Gotham, we opened up expanded access for dermatology services, which I can tell you as a Gotham primary care doctor is very much wanted by our patients. We celebrated our Doctor's Day celebration by commemorating 25 particularly good doctors at our facilities, and we were over at Queens Hospital with the borough president and a number of elected officials, including the DA, Katz, for the Claire Schulman Pavilion. Many people talked about how important she was to that hospital. So that, Madam Chair, concludes my report.
Thank you. What a wonderful, informative report. Thank you. So thank you again, Dr. Katz. We will now hear from the four facilities presenting their verbal annual reports. Each presentation is allotted, huh? What are they allotted? 5 minutes. That's the fun. That's the fun part of it. And we are grateful for the work that went into preparing them as well as you do. And a lot of you put a lot of work and time, and we really appreciate it. The board really appreciate it. Thank you in advance to all our speakers for their time and comments to the system. And so now we will start with Gotham Health Cumberland, Mr. Derek Cradle, CAB Vice Chair.
Good evening, Madam President. Good evening, all. I started my clock, 5 minutes. As the chairperson of the Community Advisory Board at the New York City Health and Hospital / Gotham Health Cumberland, I'm going to share our progress and initiatives that highlight our ongoing commitment to enhancing healthcare in our vibrant Cumberland community. A sincere thank you to Dr. Katz and the Council of CABs for giving Gotham Health Cumberland the opportunity to present at tonight's CRC meeting. We would also like to extend our heartfelt appreciation to Gotham Health leadership, CEO Michelle Lewis and her executive team for the unwavering support and guidance. Most importantly, we want to recognize the exceptional administration at Gotham Health Cumberland. Special thanks to Dr. Popley, Medical Director, Anthony Wiggins, Associate Director of Nursing, and Michelle Clark, Senior Director. Your dedication, leadership, and collaboration are deeply valued and play a vital role in our continued success. I would also like to thank all Cumberland staff members for your continued efforts and contributions. I would be remiss if I did not recognize our Community Advisory Board Auxiliary Liaison, Ms. Shailene Baker. Thank you for your outstanding work you have done and continue to do with and on behalf of the board. Your commitment makes a lasting impact. Last but certainly not least, I would like to offer a special heartfelt thank you to the Cumberland board members. I see you over there, right? Your dedication and the critical work we do together do not go unnoticed. We are strong and a committed team. We will continue to serve our community with excellence in ensuring access to the resources and support our residents deserve. So in slide 2, you see, ladies and gentlemen, we talk about the awards. In 2024, Million Hearts Champions, AHA, AMA, Gold Plus, and the AHA Gold. These awards speak to type 2 diabetes and cholesterol management, doing an amazing job. So 4 awards given to us. Slide 3. Thank you. Slide 3, within the Gotham Health System, Cumberland received first place for the most improved site in all metrics amongst all Gotham Health sites, and second place for replaced our cooling towers and improved the lighting in the parking lot for patients who visit during the evening. We also opened the wellness room to support our staff and replaced outdated imaging equipment for health screenings and care delivery. We are pleased to have received a new ultrasound machine and mammography machine, mammography? Mammography. Say it after me. Right? Thank you. Listen, my mother would be like, Derek, get it together. Slide 5, renovations. We're integrating primary care into behavioral health therapy services at our site. This would remove the need for our BH patients who come for therapy to go to the main building for primary care services. The renovation is complete, and we're waiting for inspection from the state to reopen the space. We're also renovating the radiology room to accommodate a replacement x-ray machine. We're painting areas within the site and are collecting quotes from vendors to remodel the pediatric unit. Slide 6, the radiology service interruptions. after replacement of outdated equipment and then say the word after me. The mammography service has resumed at Cumberland. As mentioned previously, radiology and x-rays have been out of service for over a year, and we're waiting for the remodeling of the space to accommodate the new unit. Patients are currently being scheduled at alternative sites. Slide 7, frequent complaints about patients with talk appointment. Slide 8, issues impacting the community. Our community continues to face challenges in accessing mental health services due to shortage of providers and also faces accessing affordable housing and affordable healthy food. Slide 9, that's 5 minutes. We have updated our signage through our facility. As mentioned before, updated equipment. We continue to train our staff in all areas to provide the highest quality of care to our patients. And last but not least, slide 10, the acknowledgements. We would like to extend our gratitude to Cumberland's clinical and operational leadership for their commitment to serving the healthcare needs of our neighborhoods in Brooklyn, as well as our strategic partners who help to amplify the impact of our work. Madam Secretary, this is
Feel bad about incorrect saying the name incorrect, because right now I think I'm getting ready to say it incorrect, but I've been practicing. So now, any questions?
No questions, just great report.
Dr. Cass?
It's an excellent report. Good job.
thank you, sir.
Ms. Hernandez?
Terrific, thank you.
Okay. So, the next wonderful presentation is Elmhurst. So now I've been practicing this name.
Raj,
Raj.
It's Raj.
yes.
It's R-A-J, so that's silent, that's Raj.
No, J is pronounced, it's not H.
No, R-A, oh, so,
R-A-J.
okay. Mr. Raj. Okay, so Mr. Raj Kabchir of Elmhurst.
So, good evening, everyone.
Good
My
evening.
name is Raj Punjabi, and I'm chairperson of the Community Advisory Board at NYC Health and Hospital, Elmhurst. I'm going to share our progress and initiatives that highlight our ongoing commitment to enhancing healthcare in our community around Elmhurst. But before that, I would like to say that 6 important things which are necessary for the betterment of the hospital: hard work, patience, sacrifice, consistency, never give up, discipline, and self-confidence. And that is because of our CEO, Dr. Helen, and her team. They're always looking for the betterment of the hospital. So now go to our slide number 2. Elmhurst Hospital is a 545-bed level 1 trauma center. Last year, we had over 1 million outpatient and ambulatory care visits. Elmhurst Hospital generates 6,000 jobs and $210 million in tax dollars. Slide number 3. We have over 125 languages for the diverse community and 4.5 million minutes of translation services this year. Slide number 4. The hospital has received recognition from US News and World Report as a best regional hospital and as a high-performing hospital in 6 categories, which include heart attack, heart failure, kidney failure, orthopedics, maternity, and hip fracture. Patient safety and satisfaction, slide number 6. We expanded emergency department ambassadors to 24/7 coverage and improved food and nutrition experience in ED and for new moms. We also implemented an EHL student business project to enhance the care experience through a hospitality lens and personalization. Patient safety and satisfaction, slide number 7. We expanded spiritual care and interfaith experience for both patients and staff and continue to implement patient-centered care frameworks to increase family presence. Building for the future recently completed. Slide number 8. We are always improving our infrastructure and equipment to meet the needs of our patients and community. To name a few recently completed projects, we moved to our business center to assist with upcoming renovation projects. We acquired a second Da Vinci surgical robot, which will expand robotic cases by 73%. We have also new sterilizers, new medical beds, and are upgrading floors and bathrooms. Building for the Future, soon to start construction, slide number 9. Some of our upcoming projects include labor and delivery room renovations, ED renovation, and new elevators, to name a few. Community outreach, slide number 10. This past year, our outreach team has reached over 30,000 people through hundreds of community health events in Central and Western Queens. Issues impacting our communities. Slide number 11. Community members are concerned about the rising cost of food and housing, which is increasing poverty in the community. Elmhurst has a food pantry every Thursday. And we cater around 350 families, which is a very high. Community members are also seeking increased access to youth centers, services for seniors, and expanded access to mental health services to support community members suffering from anxiety. Frequent complaints, slide number 12. The continued increase of patient volume in our ED has impacted admission in the inpatient units at times. We are actively working to reduce wait times, improve patient flow, and improve patient experience in the ED. In ED, we have 70 beds, but we cater more than 150 people every day. So the wait time keeps on moving around. We are also working on improving communication between departments to ensure patients receive communication in timely manner when multiple departments are involved. And this year, we have hired more nurses and 6 new PAs in ED department so that the workflow goes faster and patients are taken care of. We have also implemented the Helping Healers Heal Wellness program to address staff burnout and stress. Thank you. This is my report.
And thank you, thank you. Dr. Pecan?
In fact, I think because people see health and hospitals in a very different much affected, and part of our challenge is that our facilities were not built for the current volume. And while we can continue to staff up, I mean, I think, for example, the Elmhurst Emergency Department, it's just a challenge to have that many people in that space, regardless of how many staff members we have. It just was not built for the number of people who need it. And so we really have to, in the coming years, figure out how we're going to grow, which is, again, it's a nice problem to have, right? I mean, it's better than, the problem 8 years ago was just that people were not coming to health and hospitals because they didn't feel they would get the right kind of care. So we have fixed that, but now we have to deal with our own success, and that's going to require more capital dollars than we currently have.
Dr. Katz. Ms. Benera?
Quick question. Do you encourage family members to stay with patients after hours?
Yes,
So
we
I
have
understand.
24-hour visiting.
You do have 24 hours. That's
Yes.
true.
And we have these little cool kiosks, like if they don't want to come to they're a little shy, they can get 24-hour passes and they can click on it and just put their license on there and they have a pass. And it's cool, the little tag comes out and within the 24 hours, the tag turns red. So that way we know it's been past 24 hours, you need to go home.
Is that been a support to your
nice.
staff?
Yes and no. It does help the patient get healthy on their health journey. It helps the social worker understand some
Near. I am joined today by our Chief Medical Officer, Dr. Gagliari, and the head of our nursing facilities, Ms. Susan Sales. I'm going to share our progress and initiatives at both Gouverneur Skilled Nursing Facility and our Gotham Health Center at Gouverneur. Slide 2. At our Justin ambulatory care site, we recently completed renovations of the second floor and opened a wellness room for our staff. We are waiting for the local law 11 assessment of the building exterior, and Gouverneur needs a new CT scanner desperately. At the skilled nursing facility, we will be upgrading our gym equipment thanks to the NYC Council funding award we received. We have also refurbished our dining areas and installed security cameras on all resident units. Slide number 3, please. Safety and satisfaction. The ambulatory care site has has seen progress increase in patient satisfaction survey results. As an example, the recommended this provider's office is considered the most critical score, and as of February 2025, Gouverneur was in the 97th percentile for health and hospitals and 66th percentile for New York State with a score of 95.6%. Gouverneur was also recognized by AHA and AMA for outstanding clinical outcomes in blood pressure control and cholesterol and diabetes management. We also continue to reinforce the eye care values with staff to improve patient experience. We offer the eye care training to our staff, and many of our staff have signed the kindness pledge. Slide number 4, please. Any skilled nursing facility, safety concerns are addressed promptly and questioned on the Press Ganey survey concerning the security of the facility were given at a 91% satisfaction rating. The latest survey results show the overall satisfaction rate at 78%. Our residents are also pleased with our rehabilitation services. Gouverneur was listed again by U.S. News and World Report 2025 as one of the best nursing homes in both categories of short-term and rehabilitation and long-term care. Gouverneur maintains a 5-star CMS quality rating. Slide number 5, please. Frequent complaints. The ambulatory care has 50 complaints in NY 2024, all of which were resolved. The most frequent complaints were about communication and access. Patients also sometimes report struggles with accessing their personal providers for follow-up. Department addresses the complaints and grievances through training for staff to improve communication with patients and colleagues. Training to improve bedside manners by the Director of Service. Updating procedures to improve workflow and patient experience. Enhanced signage for patients' rights and HIPPAA guidelines, and promoting MyChart usage for patients. The skilled nursing facility received 12 complaints, most frequently related to promptness of response of staff. All complaints, grievances are investigated and findings are reviewed with the patient, resident, and addressed with staff. Staff are trained on the eye care values and on sensitivity to the patient's experience. Slide 6, please. Issues impacting the community. The Lower East Side has been a gateway for working class immigrants and continues report seeing cockroaches, which are a potential asthma trigger. Despite these challenges, the Lower East Side average life expectancy is 81.1 years, which is higher than NYC overall. The adult obesity rate is 14%, lower than NYC overall. The chronic disease health outcomes for diabetes are similar to NYC overall. The Lower East Side has also lower than average new diagnosis of HIV and hepatitis C. Slide number 7, please. Acknowledgement. We would like to extend our gratitude to Dr. Katz, the Gouverneur CAB Auxiliary, and the leadership and the members, employees, for their dedication to the community around Gouverneur.
Thank you so very much. I thought I had to do another Apollo stand here.
Just made it.
You just made it excellent. Now we're gonna have the famous Lincoln. Lincoln is in the house. Mr. Richard Arroyo.
Iconic.
Good evening, Dr. Pagan, CRC Chair Mrs. Roe Adams, CRC members Mrs. Hernandez Pinheiro, and Dr. Marthon. Good evening, Dr. Katz. Deb Brown's not here, but good evening to her wherever she is. We love her. And Okemfi. My name is Richard Izquierdo Arroyo, and I'm the chair of the CAB at Lincoln Hospital. Before I begin, I want to express tremendous gratitude for the appointment of Cristina Contreras, who is here this evening, as our CEO. She hit the ground running and has implemented incredible reforms in record time, and we are so very grateful to have her. It is my pleasure to share with you some of our progress and initiatives at Lincoln. Infrastructure projects. This year we have several infrastructure projects in progress, which include rooftop and skylight replacement, parking garage repairs, energy upgrades, electrical switch gear replacement, and replacement of our emergency generators. Lincoln now has a fabulous COO as well, Mr. Rollings, Michael Rollings, and he's overseeing these projects. We're very happy to have him on the team. Planned projects. We have several projects we are planning that will allow us to enhance the care we provide to our patients. Some of these include passenger elevator modernization, renovating nuclear medicine, the MRI suites, and installing new CT scanners and MRI scanner. We are also in need of a new doctor's lounge, are planning to install a new nurse call system, and are planning to make upgrades to the medical and surgical beds, ICU doors, lab, and pharmacy equipment. Rise Center funding. Lincoln received $6 million in funding for our Recovery Integrated Support Services and Empowerment Program. The Rice Center will be relocated from Belvis, with services co-located in one space at Lincoln Hospital on the 6th floor. Construction on the center will begin in the first quarter of 2026. The physical space is almost double in size and will allow us to triple the number of patients we serve in the first year. Frequent complaints. Attitude and loss of property are the most frequent complaints we receive at Lincoln Hospital. Our nursing, patient relations, and patient experience departments are working in collaboration to improve the overall patient experience. Some of their initiatives to address the complaints include regular rounds by patient care representatives to address patient concerns even before they become official complaints, and to escalate issues as they arise, as well as ongoing eye care with kindness training for all staff. After 30 days, unclaimed lost items are placed with a designated lost and found, which is managed by the property office. The property office is working to establish a protocol to ensure that items are returned to their owners in a timely fashion. Patient safety and satisfaction initiatives. Lincoln recently started a new Welcome Rounds program with the goal to check in with newly admitted patients, address any concerns, and make sure we are meeting their needs. Also, Plaintree recently recognized Lincoln Hospital with a bronze level certification in person-centered care. We are working on leveling up to a silver certification for 2026. Issues impacting the community. Our community faces many challenges, some of which include opioid dependence, diabetes and hypertension, maternal health issues, mental health issues, and gun violence. As of 2023, Lincoln's own Guns Down Life Up program is recognized as the first and only hospital-based crisis management community program on site. Guns Down Life Up has successfully established connections with OSHA training, resulting in over 200 individuals trained. They continue to provide valuable services in New York City schools and have expanded their community outreach efforts. Notably, their youth employment services have grown to include an anti-violence employment program, which currently has 140 youth enrolled. Additionally, 130 at-risk youth are participating in their after-school program, with 190 more on the wait list. Highlighting some of our successes. Lincoln Hospital was recognized as a U.S. News and World Report Best Hospital for Maternity Care and recognized by Healthgrades as a top 100 Best Hospital for Prostate Surgery. Our primary care services was recognized by the National Committee for Quality Assurance for delivering high-quality, patient-centered care. Community engagement. Lincoln has been engaging our community and inviting them into the hospital so that they can view the hospital as a community resource. Recent events include employment, health, and resource fairs connecting community residents with valuable resources and support services. We also had collapse in the Dominican Republic with over 200 people in attendance, including community leaders, elected officials, and the public. Acknowledgements. This concludes my presentation. Thank you for the opportunity to share this information on Lincoln Hospital with you. We'd like to extend our gratitude to Dr. Katz, our CEO, Cristina Contreras, all of our federal, state, and elected officials, and in particular the NYPD, for working with us hand in hand to improve the overall health of our people and, and improve the quality of life in the South Bronx. NYPD doesn't get a good rap, but she brought them in day one. And it's made a huge difference. Thank you so much.
Excellent, excellent. So I thank you so much, but I want to go back to our board. And Gouverneur, I think I got so carried away with your wonderful presentation that I didn't poll the board to see if they had any comments. Dr.
No questions, wonderful presentation and discussion.
Dr. Katz?
Just when you were talking about the traditional Lower East Side, I was remembering, because I love practicing at Gouverneur, my grandfather, as an immigrant, always talked about swimming in the East River and how they all did that, right, at the time. And so it's particularly nice for me to get to work in a place where he lived, 100 years ago.
Yeah, it's wonderful.
Miss Pinero?
Just a wonderful presentation and terrific services that you offer. You're just the standout in the system. Terrific.
So now, let's poll the board members for their comments on Lincoln. Dr. Katz?
All good. My only question or comment was more like, I like the patient safety and satisfaction initiatives that you mentioned and the daily welcome rounds. I'm intrigued by what that can accomplish in terms of the patient and family experience. So look forward to learning more about how that's going.
It's being well received, and it's a collaboration between food and nutrition, EVS. We have the wellness person, guest relations. Everybody comes together and they welcome all the patients every day. It's very nice.
Thanks.
That's good. Dr. Katz?
I have a little suggestion and a bigger question. The little suggestion, and Richard, maybe it's a job for the CAB. The first thing on your report was property. And that is a problem that has dogged health and hospitals. And yet it seems like, if we can repair people's hearts, we should be able to fix the issue of property. And I think that, maybe it's worth the CAB as our informants and advisors sort of thinking from the patient point of view of a variety of things that we could do. So, among the things I'm thinking of, for example, one of the things I learned when I had to be hospitalized, don't bring your ring, right? Which I didn't know. It's on my finger, it doesn't, but it turns out you can't have surgery with the ring on. Right? So then somebody has to take your ring, right? So instead of, these sort of, I'm not saying it would replace the hand itemized list, but it might be more compelling when, there's a disagreement about, what people left. But I just feel like, given the complicated things Lincoln does in saving people's lives, having property as an issue just seems like surely we can figure out that one, right? Given the other stuff. So I'm just wondering. Again, it's not unique to Lincoln. It's with all of the hospitals. As soon as you start taking somebody's property and putting it somewhere else, you're going to have a problem, right? It's inevitable.
That people in our community think they're going on a trip and they bring stuff.
Yeah.
They want to be ready. They bring a lot of stuff.
They feel safe.
But you can't use any of that stuff in the hospital, right? Anyway, that would be, Christina, on a bigger note, where are we on the planning for the outpatient facility across the street? I know it's a huge lift.
Big ticket item, yeah. We continue to collaborate and try to see about getting the support from the state and federal to see, because it's building for both of us. I have no objection to that.
I'm sorry, with whom?
The assembly person for us to collaborate with Hostos Community College,
Okay, yeah.
and that's fine. We're open to that.
So I
there's
have
been
an
some
idea
discussion.
how we could tackle that, but that's an offline conversation.
Okay.
$600 million.
Could we build housing above it? Since
I
it's
have
an
no-
outpatient, I don't know what I mean, the height I would think there's no height restriction in that neighborhood. I mean, that would be, right, I mean, if you took because I don't know how many floors you were planning on the outpatient, but if it's like 4, 6, that then does give you an opportunity, to build housing above it. Right, I mean, there is a need for housing, right, if that provides, right, you sort of need, 600 million is just we need some way to
Packaging.
package it, to do a portion of it first, right? I just think that if it remains out there as, we want this to do, we need $600 million for an outpatient building, it's not gonna happen.
Yeah,
It's just too big a price tag for most people's appetite for an outpatient building, right? So we need to either figure out, right, what the air rights are worth, right, or figure out how to build it smaller, or figure out how to build it with somebody else, or, divide the plot in half and, sell half the land. Again, I don't know what the land itself is worth. Could we take the plot, say, this half is the building and this half we have to come up with some way of shrinking that cost, or it's just going to be a forever dream of Lincoln.
I can talk to Manny. I mean, we're open. I have no objection to that. I think it makes sense. I think that would be easier to propose, collaborate, because there's a need for that.
Nearly 600,000 procedures a year, ambulatory.
Right. Yeah, no, there's no question. I mean, and again, the other thing, and I haven't been involved, and you may want to, go back and look at the plans. I remember when I was trying to build a hospital, they told me that it was going to cost, 1.1 million, and I said, I've done the polling, I can get you 888 million. They said, no, that won't be enough. And I said, so if I can get you 888 million, you're going to say no? They said, no, of course we'll take the money. So my point being, it may be that the ideal building is $600 million.
So maybe, yeah.
But maybe you want to prioritize and say in stage 1, the thing we most need is X, and that costs $200 million. See, $200 million is a much more doable number than $600 million. So again, I don't want it to be a forever dream, and I feel at this point, 600 million is a forever dream.
I'll revisit that and look at it.
It's worth-
I'm open.
It's worth looking at. If we can't do that, what could we do? Right,
yes.
what would be a reasonable thing?
Brainstorm with Manny, but also with,
The president is now the deputy mayor.
Yeah.
Right, and, he's over these kinds of projects, right? I mean, it's worth, thinking about, again, we need some other idea
Okay.
so that, some way to shrink the 600 to something that we could reasonably be doing soon.
All right, I get back.
Ms. Panera, thank you, doctor.
well, I want to say Miss Jackie Rowe Adams is the guru of guns down, life up. She is the heart of the program, and it thrills me to see the employment work you're doing. Putting
Yes.
young people to work. I know you do that a lot, Jackie, but it's wonderful that you've incorporated it as part of the hospital. So congratulations on that.
Thank you. See my bag? It says, what it say?
What does it say?
Guns down, life up. Yeah, so,
Jackie, I know you're an expert at it, but I had a recent experience with a patient of mine who was unemployed, very, very good guy, and I said, why don't you take a job at Health and Hospitals, entry level, and environmental services. And what was interesting to me is he didn't have the ability to get through the process on his own. But I got someone from our own HR to reach out and essentially coach him through what was necessary. And I think people just assume, well, it's an entry-level job. You just go to the website, you just put in your resume. And there are people who are good workers, but for whom that is insurmountable.
Absolutely.
Right, insurmountable. And in fact, I think one of the barriers was on the first callback, the email, he didn't have his own email, it went to his girlfriend. By the time he got it, it was past the day, right? But now he's working successfully, right? It's the job wasn't the problem. It was and it's good for us that, right, it was an empty job, right? I didn't do him a favor. We needed somebody in an entry-level environmental service job that we couldn't fill, and that he's doing well now. But I thought it was interesting that he couldn't on his own get through it.
You need
Right.
that support.
And so,
that support.
and so, right, I think it really says that the programs you're doing, Jackie, are really necessary because
Yes.
people, even if you think it's an entry-level job, people may not be able to get over the barriers
Absolutely.
of getting they can do the job. It's the getting the
It's
job they
getting
can't
the
do.
job and support and the necessary information. Somebody to take the time. They just want somebody to take people need people to just take the time with them and show them, say, I know how to do, but that incentive, we give them that push and give them hope. They need that hope. And so, but thank you, Lincoln. I am very proud of Guns Down, Life Up. We were all together today, and they turned up. They, as the kids could say, they turned up. Is that the word, y'all, back there? They turned up. They turned up. And,
Over 50, you're asking the wrong person.
well, listen, I'm over 70, so I'm learning. But, you know, very proud of all of you that's here tonight, especially the COs, because you know y'all are busy. You have hospitals to run. But you're sitting here tonight with your chairs of the cabs to make sure that they know that y'all have their back. And that's what's going to make them be better chairs, because they know their COs are with them. And that's most important. And we look at that, especially Dr. Katz. Don't think he ain't paying attention, because he's paying attention. And then you have our chair, and you have Ms. Pinero over here, and you're paying attention. And this is very important. Then you got a Finte. I always say his name. Did I say it right tonight? A Kente. I put the F in it, a Finte. A Kente.
I think that's the closest you've ever come. Progress is being made.
and we just want to thank him and Debbie, because they're the glue, and they keep this, and they take a back seat, and they let us do what we do. So thank you. And thank Calethea and her team, and Jaddy and Josie and Wilton. Just thank them for keeping this together. But what really impresses me is when I see all the COs here, Doctor, and they got these big hospitals to run. So I think, you know what, Cabs, we should give the COs a hand. And just keep up the good work. And on a personal note, and I know a lot of you, because a lot of you here, the COs and some of the CAB members have reached out. I just want to say thank you to all of you. For those that do not know, last month, the 26th of April, was it? Oh my goodness, was it April? I'm out. The 26th of April, I lost my son to cancer. And as I sit here today, I look around, and you know what keep me going? All of you. Because all of you played a great part. And just saying, Jackie, we need you. Keep it moving. Dr. Katz was this inspiration when I looked up and seen H&H and our chair here. You know, when you look at all these people, how could you break down and say my life is over? I knew it was hope and I knew it was help. And I want y'all to continue to support each other. And again, we cannot do this alone. Of course, I'm hurting, but you know, I was telling Dr. Katz, after all I've been through, I still have joy. And so I just wanted to say that to all of you. I'm taking the time. We're trying to get the thank yous out, but this is a better thank you. Thank you. Thank you. And with that, I think it's time to say goodbye. I know y'all don't want to leave. We're having so much fun. But the next group want to come in. No way. So, any old business? Any new business? Hearing none? The meeting is adjourned.
Good job.
This meeting is no longer being recorded.
Thank you.